A mysterious illness first appeared in the crowded metropolis of Arden City during the middle of winter. At the beginning, doctors believed it was an unusual flu because patients arrived with high fevers, coughing, and exhaustion. Within days, however, the symptoms became horrifying. Victims suffered severe bleeding, confusion, and violent behavior before collapsing. Hospitals quickly overflowed, and frightened citizens flooded pharmacies and supermarkets, desperate to survive. The government tried to calm the public by announcing strict quarantines and emergency health measures. Military vehicles blocked roads leading out of the city, and communication networks were monitored to prevent panic. Despite these efforts, the infection spread rapidly through the air, making containment nearly impossible. Videos of infected civilians attacking others began appearing online, causing fear across the country. Soon, Arden City became completely isolated from the rest of the world. Dr. Elena Ward, a disease specialist sent by the National Health Agency, arrived in the city to investigate the outbreak. While examining old medical records and underground facilities beneath Arden, she uncovered a shocking secret. Years earlier, scientists working for a covert defense program had experimented with engineered viruses designed to adapt to biological threats. The project had been abandoned after a laboratory accident, but hidden samples remained sealed below the city. A recent underground explosion during subway construction had accidentally released the dormant virus into the environment. As the number of infections rose into the millions, neighboring nations closed their borders. International experts warned that if the virus escaped further, civilization itself could collapse. Every attempt to create medicine failed because the virus changed too quickly. Behind closed doors, military leaders and politicians debated impossible choices. Finally, they approved a classified operation known as Final Shield, the destruction of Arden City with a nuclear weapon to stop the infection permanently. The public was never told the truth. Officials announced that a dangerous industrial disaster was about to occur and ordered remaining citizens to shelter in place. Meanwhile, Elena discovered evidence that one small group of survivors possessed natural immunity to the disease. Among them was a teenage boy named Noah, whose blood contained rare antibodies that could help scientists develop a treatment. Determined to save both the survivors and the possibility of a cure, Elena teamed up with Marcus Hale, a helicopter pilot who had lost his family during the outbreak. Together they traveled through the devastated city, avoiding infected crowds and armed soldiers carrying out government orders. Streets burned with riots, abandoned cars filled the highways, and smoke covered the skyline as society collapsed around them. After a dangerous journey, Elena and Marcus reached a hidden research center beneath the city where scientists were still working. Using Noah's blood, they created a prototype serum capable of slowing the virus. However, there was not enough time to distribute it before the scheduled nuclear strike. With only minutes remaining, Marcus prepared a helicopter for escape while Elena uploaded the research data to laboratories around the world. As the missile approached Arden City, Elena chose to remain behind to ensure the information was transmitted successfully. Marcus and Noah escaped moments before the explosion lit the night sky. The city disappeared beneath fire and ash, and the government declared the outbreak over. Months later, scientists succeeded in producing a treatment using Elena's research, preventing humanity's extinction. Yet far beneath the ruined city, deep inside the shattered underground tunnels, something still moved in the